So a behavior analyst is experienced and trained in finding out why behavior happens. I'll give you an example. Let's say you have a 6-month-old golden retriever puppy who they call our office or they tell one of our trainers, this dog is biting me, mouthing me, tearing my clothes, etc. And a behavior analyst would ask a series of questions that would tell them, how did that dog learn those behaviors? How is the behavior being reinforced? So we're always looking at that 3-term contingency. So what started the behavior? The antecedent. What does the behavior look like? And what's the consequence of the behavior? That's where dog trainers should ask themselves, what does the dog get? What does the dog avoid? So if I say, what happens after the dog puts his mouth on you? And they say, I redirect the dog to a toy. That tells me that the dog is being reinforced for mouthing. That's positive reinforcement, right? So after a behavior, something is added, which causes the behavior to increase in the future. So we would expect the mouthing behavior to increase because it's being reinforced. Now, if I say, what is happening when the dog mouths you? And they say, I'm trying to put his eardrops in. That tells me that the behavior is being negatively reinforced, meaning after a behavior, something is removed, namely putting the eardrops in, which causes the behavior to increase in the future. So the behavior is still being reinforced. So that's an example of positive and negative reinforcement for that behavior, right?
Right.
And there's another kind of reinforcement called automatic reinforcement, and that's reinforcement that happens inside the skin. It feels good. So this is a golden retriever that has to have something in its mouth all the time. And so I'm going to find out which types of reinforcement are in play before I recommend an intervention. Because if the behavior is being positively reinforced, then I'm going to use positive reinforcement before the behavior happens. So when that puppy comes flying up to me, I'm going to stuff a toy in its mouth before it bites. Because what we know is when you use an intervention that matches the reason the behavior happened, also known as its function, you get better results.